Good morning, everyone, and welcome to Demystifying Vaccination Testing Resources for Businesses, and thank you for joining us today. My name is Lauren Cartwright. I'm the Business Retention and Expansion Program Manager with the Sonoma County Economic Development Board. For a brief outline for today's workshop, we're joined by Dr. Shende and Dr. Mace, who will give a quick health brief on COVID-19 in Sonoma County currently. We're also joined by members from the Rapid Action Consortium, Katya Fox from GenPact, and Zach Scott from Scott Labs in Petaluma. They'll both discuss different resources available to implement employee-sponsored testing at your place of business. I will also be sharing a toolkit for vaccination verification for employees towards the end of this webinar. We have time reserved for questions at the end, but please feel free to submit your questions at any time during the Zoom Q&A throughout the presentation. If you're watching on Facebook, you're welcome to submit your questions in the comments section of the video. I'd now like to go ahead and pass it off to Dr. Mace and Dr. Shende to go ahead and give us a health brief.
Great, thank you so much. Just unmuting here, thank you. Great, well, thanks for having us. We have a set of slides, a presentation, and Kate Pack, who is our epidemiology lead, is gonna go through some data slides for us first.
Thank you, Dr. Mace. I'll just share my screen. Okay. So we'll briefly look at today's metrics to understand where we're seeing cases occur and current vaccine progress in the county. The metrics as of today are at about 10 new cases per 100,000 residents per day. And you can see, similar to the trend that we're seeing across Bay Area counties, we are seeing decreased transmission in our community. In the context of the old blueprint framework that the state had in place, we would still be considered in the purple tier, which would indicate widespread transmission, but we are seeing a promising trend in decreased transmission. Similarly, we're seeing a decrease in our overall testing positivity, as well as our testing positivity in the lowest quartile of the Healthy Places Index. And those are the areas of our county in which residents have less access to resources to support their health and well-being. Our hospitalizations are also declining. We have 38 individuals hospitalized with COVID-19 as of data reported by the hospitals yesterday, with 18 of those individuals in the ICU. Of concern, just since July 1st, 65 people have died from COVID-19 complications. Looking at transmission by vaccination status, so when we look at the rate of cases per 100,000 population, we see consistently a higher case rate, shown here in the orange color, among our unvaccinated population as compared to our fully vaccinated population. And so as of today, there are about 12 new cases per 100,000 among unvaccinated, as compared to about 3 new cases among the fully vaccinated population. But similar to our overall trends that we're seeing, we are seeing decreased transmission in both of these populations. Looking at our case rate by city, we're also seeing declined case rates in most geographies. When we look at the number of cases occurring in the past 60 days, we see the greatest number of cases, and you can see the number of cases shown here under the name of each city, in Santa Rosa, in Petaluma, in Rohnert Park, and in Windsor. Relative to population size, however, we see the highest case rates per 100,000 population in Sebastopol, Cloverdale, and Sonoma Valley. We have seen a great increase in the testing occurring in our county. Our testing volume currently remains high. We are back at levels that we saw during the winter surge. Testing volume is beginning to stabilize, but it's at about 606 tests per 100,000 residents per day. And we've seen testing increase for all racial and ethnic groups, age groups, and geographies in the past month. Looking at cases by age group, we continue to see the majority of new COVID-19 cases among the younger and less vaccinated age groups. Looking at source of infection, this chart shows our active cases as compared to cases 30 to 44 days ago, as compared to cases over all time. And this area of the chart, this kind of green color, is showing the proportion of cases for which we aren't able to gather enough information to really make a determination about where transmission occurred. And that's because individuals are not always willing to share information with contact tracers. And sometimes people just don't really remember, thinking back to the past 14 days of where that transmission most likely occurred. But among the proportion in which we do have enough information to make a determination, we can see among active cases that household transmission, represented here by this color, accounts for the majority of cases that we see, followed by gatherings, large and small, currently at about 26%, accounting for 26% of cases with known source of transmission, as well as work site transmission. And we'll look a little bit more at cases by occupation. So when we look at cases by occupation, and it's important to note on this chart that this is not necessarily where transmission occurred. This was just what individuals who became positive, these are the occupations that they reported that they had in the past 60 days. And so for many individuals, it was unknown what their occupation was. That wasn't shared. But you can see cases in sales and services, unemployed, retired, and healthcare workers, construction. So these are some of the places that we're seeing cases. Child is just indicating they didn't have an occupation, but we have seen cases among children as well in the past 60 days. Looking specifically at where instances in which transmission was known to occur in the workplace, we can see that when we look at cases over all time, the professions in which there was the highest proportion of transmission occurring in the workplace included healthcare, public safety, manufacturing, caregivers, food and beverage production, transportation, agriculture. And just to provide an interpretation of this chart, the number on this side represents all of the cases that we have seen in these occupations, regardless of where transmission occurred. The number here, the numerator, is representing the number of cases that were due to worksite transmission. When we look at these same figures over the past 60 days to look at recent trends, we can see that when we just look at the largest number of cases by occupation, we can see the most cases in sales and service, healthcare, construction. But when we're looking at the proportion due to worksite transmission, the highest proportions are in transportation, public safety, healthcare, construction, and agriculture as well. And we have been seeing cases in schools since reopening this fall. Currently, there have been 451 school-related cases, the majority of those among students and elementary school students specifically. Of these 451 cases, 69 have been confirmed to have occurred due to on-campus transmission. So that means that a student was identified as a close contact of another positive case on the campus, and then they later became positive themselves, or through the case investigation, it was determined that campus was the most likely source of transmission. When we look at our hospitalizations and looking at the rate of hospitalizations by vaccination status, we can see that overall, unvaccinated individuals in Sonoma County are have a 7-time higher hospitalization rate than fully vaccinated. And during the Delta surge, we saw that unvaccinated individuals were 14 times more likely to be hospitalized than fully vaccinated. Looking at our vaccine progress, we're currently at 76% of individuals 12 plus who are fully vaccinated. Looking by age, you can see that there's still a smaller proportion. This darker color here represents fully vaccinated. There's a smaller proportion of these younger age groups that are fully vaccinated as compared to the older age groups. However, when we look at new vaccinations occurring, we are seeing the greatest increases in these younger age groups. So progress is being made. This is the 12 to 15-year-olds, 16 to 24-year-olds, 25 to 34-year-olds. Looking at vaccination by race and ethnicity, we see that a smaller proportion of Latinx, American Indian, Alaskan Native, and multiracial residents are fully vaccinated as compared to other racial ethnic groups. But we're also seeing progress here with an increase among the total number of Latinx residents who are fully vaccinated, increasing by about 1.5% to 2% each week. So overall, with vaccine progress, we're seeing, this is looking at the number of vaccinations per week in our county. Well, that initial demand for vaccinations has decreased. We are still making steady progress, and about every 1 to 2 weeks, we're seeing the percentage of fully vaccinated in our county increasing by about 1%. And the county is preparing for increased demand once booster doses are reduced and the upcoming expansion of eligibility to 5 to 11-year-olds. And that's the end of the slides.
Thank you so much for that information, Kate. Dr. Mace, Dr. Shende, is there anything else that you'd like to add with regards to the current status of COVID-19 in the county, different transition rates, the effectiveness of the vaccine? Feel free to jump in.
Just jump in with one comment. So things are changing around here every day. So the boosters were approved on Friday, as you all may have heard, and in Sonoma County, and in accordance with the CDPH, we've approved the boosters for 4 categories. And the first 2 are should get vaccinated, and the last 2 are may get vaccinated. So those in the should get boosters category are those over the age of 65, and those who are 50 to 64 with chronic medical conditions as defined by the CDC. Those who may consider getting a vaccine are those 18 to 64 with chronic medical conditions, or those 18 to 64 who have increased occupational risks, such as healthcare workers, or those who had been in the first initial tiers, such as teachers and community health workers. So those boosters are now available. And in terms of the pediatric vaccines, just yesterday, Pfizer submitted their data to the FDA for approval, and that's going to take a few weeks. So we anticipate in 4 to 6 weeks, hopefully there will be a good, safe, and effective vaccine for the age group of 5 to 11.
Yeah, thanks for that. And I can just add that quick update on orders and recommendations. I don't know, Kate, if you have the one slide that sort of summarizes, the table that summarizes the orders and recommendations.
I can try to pull it up. I don't have it handy at the moment.
Okay, I'll just start by saying that several different orders required compliance by last Friday. One of them was the vaccine verification mandate for the K through 12 staff and volunteers. And again, just to go over that, the state put out an order for vaccine verification and routine weekly testing of unvaccinated persons in staff and volunteers in all K through 12 schools with a compliance date of October 15th. However, here in Sonoma County, I issued an order that moved that compliance date to September 24th because our schools were prepared to come into compliance earlier. So that happened September 24th. The vaccine verification and testing of unvaccinated amongst fire law and EMS. The testing, all the fire law EMS organizations or agencies had to be in compliance with testing unvaccinated as of also September 24th. So this is a nice table that just kind of shows all the different orders that have been put out. We had our masking, indoor masking health order that was released on August 3rd, and it's still in effect. And that is that's actually a masking mandate. Then there is a state order for a vaccine mandate for correctional facilities and detention centers specifically for healthcare workers. And that will be in effect October 14th. We here in Sonoma County have a order for testing of all inmates at the time of incarceration with a antigen test, a rapid antigen test, and that is going to be in effect as of this Friday. And then let's see, we've got, I've already talked about the vaccine verification order from the state, but there's also a mandate for healthcare workers to be vaccinated unless they have a medical or religious exemption by September 30th. And then, let me quickly go through this. I think we've talked about the fire law EMS, acute long-term care facilities. This is a requirement for visitors in acute healthcare and long-term care settings to show proof of vaccination or a negative test within 72 hours of the visit. Talked about the schools. We do have a recommendation for outdoor masking in school settings, guidance for youth sports and extracurricular activities that can be found on our website. And then of course, all county employees as of last week had to show vaccine verification proof or undergo weekly testing. And this is most important, I think, for this group. We have a recommendation to all Sonoma County employers to do the same. In other words, verify vaccine status and perform routine testing for those who are unvaccinated, or require a test, I should say, of unvaccinated employees. So I'll stop there, and I think if we could take some questions, that'd be great.
I don't see any questions coming through on the Q&A feature. I don't know if we have any on Facebook yet. I can keep an eye. Feel free, attendees today, if you want to submit any questions at any point during the presentation or save it towards the end, please let us know. If there aren't any questions right now, we can go ahead and jump to the testing resources with our guests, and then we can kind of check in after that before we talk about some of the business slides that I have, and we can just kind of keep checking periodically for questions if that works.
That sounds great. I can stay for the entire presentation. Dr. Shende is going to have to jump off in about 6 minutes.
Okay, sounds good. Well, why don't we go ahead? Thank you so much for the update on COVID-19 in Sonoma County. We'll go ahead and get started with Katya Fox from GenPact and Zach Scott of Scott Labs. They're with the Rapid Action Consortium, and they're here today to share different testing resources that are available for businesses. So again, for those attending, please feel free to drop any questions into the Q&A right now or Facebook at any point during the presentation, or we can do it at the end of the presentation as well. So with that, Katya and Zach, I will let you take it away.
Maybe just as a brief introduction and as a thanks for having us. I spoke with a group from the county a couple of weeks ago with Katya as well about the program that we've instituted for our company, as well as our partner companies across the US and in Canada. It's worked very well for us, and I'll let Katya introduce the plan because she has spawned much more of it than we have, but then I'm also happy to give an example of how it's worked in a real life context within the county.
Awesome, thank you so much, Zach. So as Zach said, we are a consortium that has been running really across Canada and the US. The US specific consortium is led by 3 organizations, GenPact, the Canadian Rapid Screening Consortium, and the COVID Collaborative. So GenPact being a private organization trying to figure this out for ourselves, as well as the 2 nonprofits that I mentioned, really trying to help other businesses figure out how to navigate COVID and reopen the economy. And in Canada, the consortium started in September of last year. A lot of research was done around how to stand up a good screening program. The ultimate decision was made that rapid antigen tests are definitely the way to go. And there's a number of reasons for that versus PCR. First is cost, of course. Rapid antigen tests are much cheaper. They tend to come in at under $10 a test or so, compared to, around 75 for PCR, if not significantly more. There you have Scott. Zach's showing the Binax now. Yep, that's one of the over-the-counter rapid antigen tests that the consortium uses. We also believe that it's important to get the results quickly. So rapid antigen gives the results within 10 to 15 minutes. PCR can take often an average of 48 hours or more. And knowing the result is very important early, because we don't want people who can transmit COVID to be going into the workplace, mingling, potentially getting others sick. So it's really important for us to know whether or not somebody is infectious early on. And that's also what these tests are designed for. Rapid antigen tests are designed to identify infectiousness, not just presence of infection. So it's really pulling people out of the system that have the ability to transmit. So that's just some background on why we've chosen rapid antigen. And specifically, we go with over-the-counter because it has such great flexibility for where people can test and how people can test. So I know that Zach will talk a little bit about the program that Scott Labs has, but our members have a variety of different approaches that they take, whether testing at home or testing in the office, whether testing, at the front desk in a separate area, or as a group with everyone at their desks at the same time. Over-the-counter really allows you a lot of flexibility there. So, the consortium, really, we're here because there's often a lot of questions that come up when you're looking at how to implement rapid screening. We had all of the same questions when we first started looking at this. Which tests do I use? Where do I buy them? What kind of consent do I need from my employees? How do I capture that data? What do I need to report? What do I not need to report to, state and county authorities? How do I track all of this information? How do I educate my employees on taking this test and kind of manage the entire program end to end? That's really what we as a consortium are designed to do, is help you manage that and figure out how to stand up your own screening program that's unique to your needs and your workplace. And also, we're here to help with supply chain, of course. As you know, there's a huge squeeze on rapid antigen tests, in particular on over-the-counter tests. And you might be going on the Walmart website and seeing out of stock for the past few weeks, and same with Kroger and CVS, and even going into the store, a lot of these organizations are putting limits on how much they're selling to one client. So we have several connections with the leading manufacturers of the over-the-counter tests that are available. Currently, there's 3 different test manufacturers that have over-the-counter test emergency use authorization, and we have access to the manufacturers of those 3, as well as other third-party distributors. And so we've been lucky enough to have the right advisors and the right supporters to get supply to our members when supply has been extremely, extremely tight. So that's just a quick overview of what we do. There's no fee to join the consortium. We welcome anyone and everyone who is willing to kind of share their information, share their learnings, their best practices, and we'll hand over a playbook to you, all of the contacts, get you connected, get you a buddy within the consortium. Yeah, Zach could be your buddy for sure, and kind of get you started and get your program up and running. So if you're interested in learning more, Zach's going to go into an example, but I'll post some links into the chat as well for you to explore. Zach, over to you. It would be great to hear.
Thanks,
And
Scott.
Zach, actually, before we jump in, I just want to check in with the audience too today, just to make sure that everyone's understanding as well what the Rapid Action Consortium is like for you and how they can be of assistance. I don't know if this will help frame some of the questions you might have today, but just understanding that they are a resource for your testing, like they're here to help businesses in Sonoma County. So as Zach goes through the playbook, please feel free to kind of put in any questions into the chat. Again, this is a really great resource as you try to navigate how to promote safe working environments in your different businesses. Sorry, with that, go ahead, Zach.
Yeah, no, I appreciate that, because it's this very unusual, free, altruistic thing. So it seems like there's a catch, but the catch is that there's no catch. And I'm very grateful for it, because so our sister company had already been involved in it in Canada and passed it on to us. And it was a challenge for me to quite grasp why it made sense for us at the time, because early in the summer, you may remember caseloads, our case counts were very low, but also testing was very low. And so it was presented more as an active step to maintain screening. And I'm glad we did it because we were really ready and prepared for the Delta surge to come through. And we were able to set up a system that was functional for a reasonably small firm. So we have 98 employees in the US, and everyone's involved in the program in one way or another, regardless of vaccine status. And having it in place, I do credit with having screened out 4 individuals that were all breakthrough cases. They all had been vaccinated, and they all tested positive on the rapid antigen test, did not come into the office, subsequently had PCR testing and were positive. And so the testing program itself prevented 4 of our employees from coming into the office and potentially causing a much larger event. And being able to execute that program as our company, which even though it sounds like it's maybe related to medical, we do wine testing and we do yeast sales and cork sales. So we are not well acquainted with epidemiology. And so being able to lean on a much larger group and getting their best practice, let alone the access to the tests themselves. So with the shortage, we've been able to keep running by being able to do these direct orders and have the support of the COVID Collaborative and RACE. So the program that we've set up allows all of our employees to effectively test at home before they come in. So we send employees home with the Binax kits. So we order by half pallet or by full pallet, and then we'll distribute. We're typically distributing, there are 2 tests to each kit, and we test twice a week. So we actually send out easily Outlook reminders to all of our employees. They receive it. It has a link to where they can go and log their results, and it reminds them Mondays and Thursdays. We try to make it easy. And then we're able to collect that through just as simple Microsoft Forms, which again, can be supported, but it's a very simple tool that can be launched. And it's something that really all of our employees from warehouse to remote sales have all been able to become part of this program easily without any barriers from a technological basis or otherwise. The information that we share back to RACE and allows, I think good just general knowledge for the public health community and for RACE about how this is working. And we were able to use consent forms that allowed all of our employees to engage and to do it on a voluntary basis initially. Recently, because of just the current risks that are prevailing, all of our staff that interacts with customers, we do have mandatory testing regardless of vaccination status for our company. But again, having this in place allowed us to very simply launch that. And we have effectively, we have all but 2 people in our company actively engaged in the program on an either voluntary or required basis. But I'd say that it's by and large 100% voluntary. People want to engage in it because it's also made them feel much more comfortable being part of the office community, part of the team that they're on, knowing that they're helping to keep their colleagues safe and that they have a better sense of being safe within that environment, not just for themselves, but frankly, for their families as well. So I would highly endorse this. I'm very open to pay it forward and support anybody that does want to investigate this for themselves. But again, as Katya put in those links, the RACE really has been an excellent resource for us to make sure we can prop this up for our business.
I do see a question came in around whether we test vaccinated and unvaccinated 2 times a week. So currently, all of our members are testing both populations twice a week. The reason for that is that we have yet to experience a workplace where our public health advisors and epidemiological advisors believe that the vaccination penetration is high enough to just test unvaccinated folks. Now, I know we have several new members joining us that expect to only test unvaccinated people, they're unvaccinated employees, and that's not a problem at all. We absolutely support testing anyone that you can test, and but for now, all of our members are testing both populations. That may change as vaccination percentages increase.
And again, to reiterate, in our situation, all 4 of our positive cases were breakthrough cases, so they were all vaccinated.
So are there any other questions coming through that we can go ahead and get answered? Thank you so much for that example. I think it's very helpful, I think, for people to kind of understand what their business model is and what other folks are going through as those are planning or looking to be a part of the consortium. They can just kind of visualize how that might work out for their operations.
And maybe just to add too, from a real just nuts and bolts operation standpoint, it's probably taking about 5 hours from one employee a week to manage this. So it's maybe last week was a little bit more intense because we were scraping and scratching for some stock, but by and large, it can become a very modest amount of work for a structure that doesn't require dedicated personnel to be doing this. How much does rapid antigen test cost? It is costing us as a whole group. It costs us about $4,000 a month as a company basis. The individual kits, I think, Katya, are how much right now for the
around $8 a test, and they come in 16 per kit.
Yeah. And which we cover 100%. But to be honest, and I've had this conversation with the county too, and they know my thoughts. and I'd recommend anyone here that would want to engage in this. I think, you know, this is critical to maintain the open posture of business in our community. So from a public goods standpoint, I think this is really a conversation we should ultimately be bringing to our political figures and asking, what is the resource available for business at the end of the day? And is this something that we can ultimately offset from a tax basis or otherwise? Because not everyone is going to have the ability to do that.
Yeah, one thing I was going to ask is, are there creative funding solutions that businesses have so far to kind of pay for this type of testing? We understand the importance, but like you're saying, there's the finances and the impact. Like, has anyone found a creative solution like that participates with the consortium?
Not sure about creative solutions yet. We know that some of the states have started offering free tests delivered straight to residents' doors. So I believe Iowa and Colorado were, starting that up in the past few weeks. I know that North Carolina had a pilot program that they ran a few months ago. Actually, that was really exciting. So we're hoping that states actually step up to the plate and hopefully make free testing available, as we've seen done in other countries around the world. Just one thing that we've been talking about since the Biden announcement came out around the OSHA directive that we're waiting for more information on. We know that the government has purchased several 100 million tests. And so they're planning, our understanding is that they're planning to make those available through a number of retailers at either a discounted price or for free in some cases. So the question becomes, depending on the OSHA directive, some organizations may choose to put the burden of testing on the employee themselves if they do plan on testing only unvaccinated employees. It's something that we're discussing with the consortium. It's not exactly sort of aligned with our mission and our approach of making it as widely available as possible. But I know that it's something that certain organizations are talking about, especially because it may become easier for individuals to acquire tests than it is for organizations to acquire in bulk. And also, if you're trying to really push vaccination and get people to switch to get the vaccine, it may be one more reason that they would do so, is if you put that burden of getting a test on the employee themselves. So that's really the only creative solution we've been kicking around. But yes, big hope is that states step up and try to help cover the cost.
I don't see too many questions coming through. So for the attendees today, we have a few slides just kind of around the current regulations in the county, different information around employee vaccinations. So we can kind of run through those and then open it up for Q&A. Maybe going through those regulations will kind of inspire some questions based on what Katya and Scott and Dr. Mace, Dr. Shende shared with us earlier. So thank you both so much for that information presentation. We'll go ahead and jump to the next one. And just give me a moment and I will share my screen with the group. Okay, and we'll just run through a couple of brief slides with some different information around, the employee proof of vaccination with the county. Essentially, as Dr. Shende, Dr. Mace have mentioned, the importance, and all of their staff, the importance of the vaccine, and that is the strongest tool in mitigating COVID-19 in both the workplace and the community. And the county recommends implementing employee proof of vaccine protocols in the workplace. Whatever method of proof and documentation is used for determining the employee's vaccination status, the information must be kept confidential and stored separately from the employee's personnel file. So that's a very key component. While we understand the importance of getting that testing done or that proof of vaccination, the confidentiality is of the utmost importance for both the employer and the employee. We'll jump down to fully vaccinated information here. So we've all kind of heard about the different vaccinations that are out there, whether it's Pfizer, Moderna, or the J&J or Janssen shot. People are considered fully vaccinated for COVID-19 2 weeks or more after they've received that second dose, or in the Janssen case, that first dose. So just reminding ourselves, what does it mean to be fully vaccinated and how that will impact the different protocols. So you have an employee who you're testing weekly and how that changes once they do or don't decide to get vaccinated. And then looking at the different forms of proof, we've got a COVID-19 vaccination card. You can do a copy or a photo of that card, a medical record, the different digital record that launched with the state. One of the very important things to think about in terms of a medical record or some sort of other medical proof is you want to make sure that any of the information from your employee that is not pertinent to that COVID-19 vaccination is somehow hidden. You don't need to see everything else around their health check when they went to the doctor to get the vaccination. You just want to know, is this person vaccinated or not? Some employers have suggested, almost censoring or blacking out the information when they request a receipt or copy of it. Please note that for the County of Sonoma, at this point, they do not recommend doctor's notes just because of this instance and the other personal information that could be included with that verification. Okay, and then we'll jump down for here. So methods of documentation, like I said, employees provide proof of vaccination and employer will maintain a copy as well. So whatever that document is that you choose, whether it's the vaccination card, a medical record with hidden personal information, both the employee and the employer should maintain a copy. If not, if for employees who choose to not get vaccinated, the importance of those weekly viral tests, we'll have a great partnership, with the consortium to try and get that done for folks. Just thinking about, okay, do I have employees, what are the interactions that they have with all the different staff members? At what rate can I support them getting tested if they do not want to get vaccinated? And then some different things you can do here, the different testing examples for public testing locations. SoCo Emergency has a really great resource for different places that folks can go to. Alina, if you wouldn't mind putting that in the chat, that would be great. And then just so we can get some Q&A time here, let's go ahead and go down to some of the available resources. So we have some information in the chat around the Rapid Action Consortium. There's also different links here, and we'll make sure to share this presentation, the different links as well, but around COVID-19 employment FAQs, different emergency temporary standards. So as Katya mentioned, the different regulations that are coming from OSHA. This link here has some of the emergency temporary standards that are in place. As new standards come out, they will be uploaded here as well. We also have socolaunch.org, which is a webpage that our team developed here at the EDB. And there's a specific page for all COVID resources, whether it's workplace exposure or testing or vaccines or guidance or can my business be open? We have all of that information located on socolaunch.org. So we want to make sure we have enough time for questions. We have about 15 minutes left. So if anyone wants to submit questions via the Q&A feature or via Facebook, we're definitely monitoring, and we want to make sure we can get any information to you possible. If you don't have questions now, we'll make sure we include contact information for any of the individuals here today, so you can follow up with questions. Maybe if you have something down the road, or if you meet with the rest of your staff after you kind of talk about the different protocols, we are definitely here to support you. So with that, let's see. Hopefully a couple of questions were answered during those slides. Let's see here. So we have a question here. Sonoma County is not requiring mandatory proof of testing for hospitality workers yet, correct? We have them all complete attestation forms, but not proof of vaccines. Dr. Mace, do you want to chime in and we can talk about this mandatory proof of testing for hospitality workers? But I don't believe that is in place yet. Okay. I think, Jan, we may need to follow up on that question, but we'll make sure that we make a note of it. But you're correct, as of right now, it is not a requirement.
Hi, sorry about that. Lauren, so can you clarify that question one more time?
So one of the attendees was kind of asking about mandatory proof of testing for hospitality workers. I don't believe that's the case as of right now. I mean, she was just talking about at this point for their business, they're just focusing on having the employees complete attestation forms, but they are not doing the proof of vaccines.
Yeah, there isn't an order for anybody outside of the high risk settings, like healthcare workers, staff at long-term care facilities, the K through 12 school staff and volunteers, fire law, EMS, and county employees. Those are the people who are under an actual order for vaccine verification. And if unable to show proof of vaccination, weekly testing requirement. That's the only group. Now, there is a high recommendation that I put out for employers and businesses to do the same. And that would be up to the resources for each business. It makes sense to verify vaccine status if you can, because then you'll know essentially, what percentage of your workforce is vaccinated. And then there's a recommendation to do some sort of require some sort of serial testing of unvaccinated individuals just to protect your workforce. And you could do it weekly. You could say every 2 weeks, a person should get a test, or if symptomatic, obviously. We also have a recommendation that all students now, be tested in some routine manner. And we've left it up to the schools to determine how often, and maybe 25% every week be tested or something like that. And we were talking a little bit about maybe potentially a vaccine verification recommendation as well for students in schools. These are recommendations, best practices, not orders.
I think one important thing to think about from a business is every business is different, whether it's the number of employees you have, the hours you operate, the days you're open. So it's important to think when you're putting in that testing protocol based on the county's recommendations, what works best for your business. If you know that you have 10 employees and 9 out of 10 are vaccinated, how is that going to dictate, what your testing protocol is, and kind of just looking at that. And if I'm not mistaken, Katja and Zach, when it comes to the Rapid Action Consortium, that's where maybe they can help you determine, where to get those tests and how to put those protocols in place and just how to make sure you're creating a safe work environment for your employees. I have another question here.
And one thing, Lauren, we don't have our county council on this meeting. However, I think if a business actually wanted to require vaccination itself, that would be up to that business, I would think, like I think Delta Airlines, for example, early on in the pandemic required vaccination. I don't know, Kate, if you know anything more about that, but I think that, like I said, we don't have our county council here, but I can clarify that. But I think that the business can decide to do that if they want to.
Great. Thank you, Dr. Mace. And it looks like we have another question here. And let's see. For a restaurant owner, it's very difficult to figure out this process on their own. If they're not able to afford that testing twice per week, how do they determine if they should provide tests when people come back to work after being on vacation? Any advice or program? So I think that's kind of talking about what you're saying. There's recommendations and there's suggestions, but it's up to those business owners to find the right programming that's going to work with their staff and what they feel comfortable with depending on how they operate.
Yeah, exactly.
And then we will put a link in the chat as well for fair housing and employment. There's some different resources for employers that want to require vaccination, and we can put some resources there for suggestions on protocol as well. Let's see. Are there any other questions from the attendees today? I know it's a lot of information, and we were trying to break it down the best that we can, but we're all available to be here to help answer questions. Again, if you want to follow up afterwards, edb@sonoma-county.org. We're happy to answer those questions, or at least kind of filter those to the right folks to make sure you get the answers that you need. Well, if there aren't any other questions coming through, I don't want to take anyone else's time, but please feel free to reach out to us if we can ever be a resource for you. Thank you so much, everyone, for being a part of the workshop today. Dr. Mason and Dr. Shende had to leave, but thank you to her as well as Katya and Zach. For any questions, please let us know. We'll send a follow-up to the group, and this video will be posted on our Facebook page for future resources as well. But thank you, everyone, so much, and have a great day and stay safe.